Before we start, just a couple of housekeeping things. First of all, if you have a phone or any electronic device, please turn it off. All electronic devices turn off except for your pacemakers. That's the rule here. Second thing is, if you do get a phone call, we ask you to take it outside because no matter how polite and quiet you try to speak, it's going to interrupt and distract folks nearby. There's a sign-in sheet for continuing education credit outside. Please sign in if you're interested in getting the credits for this. Okay, without any further ado, let's begin. And we're just an extremely important topic, burnout, and also the management and building of effective clinical teams. And we have two experts in it. And they need no introduction because they're going to introduce themselves as part of their talk. And I might say that we're very delighted to have both of them. They're like family, moving chairs, helping us in every way. And they're going to help us more with their talk today. Welcome.
Good afternoon, and thank you guys so much for coming. Come in, make yourself at home, and I understand we're being joined by folks in Milford and Providence and Peninsula Regional, and also, I guess, through WebEx. So we're really looking forward to today. I realize that the flyer that got you here was all about burnout, but we're going to flip it and really try to make you guys feel like you're not alone and give you some real practical strategies to reconnect with the joy in your work and with the people that you're working with. So hopefully we'll have some fun this afternoon. I'm going to start by introducing my colleague, Cheryl. She's a practicing nurse practitioner, family nurse practitioner. She has dual degrees in both public health and nursing. She has been practicing for over 30 years and still sees patients, which I think is something that's super important, at a federally qualified health center in Pennsylvania. Takes care of primarily Hispanic patient population there. She's the Chief Nurse Practitioner Officer at NNCC and helps manage a lot of the federal grants. I know some of you guys are here from the Transforming Clinical Practice Initiative, and that's a grant that we both are working on. A fun fact about Cheryl was she wasn't always sure that she wanted a career in healthcare. After college, she went to West Africa and served in the Peace Corps, and it was after she was in the Peace Corps that she realized that healthcare was what she wanted to do. So I'll pass it over to Cheryl.
Thank you. Thank you, Daisy. I like this idea of introducing one another. I think it's really great. Well, welcome, and thank you for coming and taking your time out of your busy day. We all know there's not enough hours in those days. So we hope that this content is something that will make you take a stop and think about, the work you're doing and why you love what you do. So let me just start by introducing my colleague, Daisy. So Dr. Daisy Smith, she's a practicing general internist with a special interest in medical education. She's a former internal medicine residency program director and also still sees patients once a week in conjunction with UPenn, where she teaches residents and also provides backup for a number of other types of providers, nurse practitioners, clinical pharmacists in West Philadelphia. Her role at the American College of Physicians is as Vice President of Clinical Programs, where she oversees the Centers for Quality and Patient Partnership in Healthcare, Practice Transformation, as well as Well-Being and Professional Satisfaction Initiative, which I think is wonderful to have that embedded in medical and, medical training and teaching. Fun fact about Daisy. Daisy was formerly a varsity ice hockey player in college. Yeah. Okay, there'll be some hockey stuff later. And her specialty, and I had to ask my husband what this was penalty killing. So it sounds not euthanasia or anything on the ice. It's just, okay. But she says it was excellent training, I'm guess, for work, but also for raising her 3 sons. So just a moment to tell you a little bit about ourselves and our organizations. So we are both working with the Transforming Clinical Practice Initiative. I am from the NNCC, which is the National Nurse-Led Care Consortium. We are a membership organization that supports nursing on the front lines of care. TCPI is the work that we are doing. Part of this is driven through that, the Transforming Clinical Practice Initiative. Of note, in the Transforming Clinical Practice Initiative, we are the only nurse practitioner and nursing-focused support and alignment network. So that means we bring national recognition to the role of nursing in transforming primary care.
And I'm from the American College of Physicians. We're a nonprofit membership organization. We represent over 152,000 internists, both generalists and subspecialists throughout the nation. And our mission is really to improve patient outcomes through engaging in our clinicians and really helping to promote excellence and professionalism in the practice of medicine. We are also a support and alignment network for the Transforming Clinical Practice Initiative.
So I wanted to talk about our objectives today and some of the things that we're going to be reviewing. And I'm hoping that our remote sites can hear and see what we are presenting. So please let us know if we're loud enough. We want to make sure that you're part of the process here. So we wanted to think about and talk about reconnecting back to joy in work, brainstorm current challenges that you all may be facing, which may be similar or different, and really address those head on. Discuss the key features of what makes a high-performing team and practical ways to implement that, because that will have an impact on your joy or lack of joy in work. Discussion of your personal strategies. We often forget about ourselves when we think about balance, but we need to do that, and we'll give you some strategies. And then ask you actually to walk away today with one strategy that you can bring back to your practice, to your lives, to implement, either a personal or a professional one, and we'll give you some options of things to look at.
Okay. So first we're going to start by talking to each other. What I'd like you guys to do first is sit there and think about a time over the last month, a moment in time when you were at work and you felt like you were at your best. So I'm going to give you some time to think about that, and you may have to go back further than a month. There's no policing this here, but to come up and really think about that moment and what made you feel like you were at your best at that moment. And then we're going to have you turn to the person next to you and share that with the person sitting next to you. And after 2 minutes of sharing, I'll ask you guys to switch so that you can share your stories with one another. So let's go ahead and start thinking.
Never not chewing. You get to go first.
We don't want any aspiration here today.
So for the remote sites, please be doing the same. Talk to one another and introduce yourselves. Yeah. You have about another minute before we switch.
All right, so if you haven't switched, I love hearing the buzz in the room, but if you haven't switched yet, go ahead and switch and listen to the other person's story. Sounds like I don't want it winding down. All right. So for those of you who are just joining us, it's great to hear the buzz in the room and to see the smiles. And I think we were hearing a little bit of laughter there too, which is great. So people were sharing stories about times when they felt really good at work. Change this. So who wants to share what that felt like? What did it feel like to sit? Maybe you knew the person sitting next to you, maybe you didn't. Who wants to share? I'm not asking you to role play, just share. Yeah.
Thank you. No, it was really exciting. I'm just Jessica Taylor, clinical nurse specialist with palliative care. It was really exciting because I felt like I hadn't got to share how I felt with my team yet about like a great feeling of being productive at the in our practice. And so I had that opportunity, and so to be able to share that with the people that I know would get it was really cool. So I'm glad I am excited, and now I'm content with that. So good feeling.
That's awesome. So who else wants to share what that felt like to talk about a good moment at work? What struck you about that? Taking the time to talk about positive things. Anyone? Anyone want to raise their hand? Yeah.
Well, I think I'm Tina. I work in cardiac surgery. So I think being able to tell somebody positive instead, it seems like we're so fast to talk about the negative, and being able to share a positive moment in your day is really something nice. And I've never met these two, so to be able to tell them something positive, you know, in something that you do is really nice.
Kelly, infection prevention. I was going to pretty much mirror what she said. We focus so much on what we can do to do things better that we focus on what we're not doing well instead of focusing on the things we do well. So I think we're always in that mindset. So it's important to do the positive stuff.
Great. So you guys are an excellent audience and wonderful students of this because I think, I mean, certainly where I work clinically and in my administrative role, we spend so much time complaining. And it's almost like that's the socially acceptable way to interact. I don't know about you all, but we also I spend a lot less time with people face to face too. which is another issue with the electronic health record, and you're constantly messaging back and forth and you don't talk to people the way you used to. But when you have that precious time to connect with one of your colleagues, and we waste it complaining. So that's one of the first take-homes that we have today is, understand the positive of power, the power of positive stories. And the reason we're talking about this, and hopefully part of the reason you came here today, is because you're aware of the burnout epidemic. And over half the population of clinicians in this country are burned out, and the problem is getting worse. I think there were 2 doctors at NYU who killed themselves just last week. We lose an entire medical school class a year to suicide, death by suicide. And so this is a really big growing problem. Some would say it's a public health problem. The wonderful news about the fact that it's risen to this is terrible, but that people are starting to pay attention. So you'll see articles in the lay press. The National Academy of Medicine, which used to be the Institute of Medicine, has created an action collaborative and is beginning to do a major review to take this on, like crossing the quality chasm. Can you believe it's been 20 years since the Institute of Medicine published that paper? So, and the other good news is that there's some research out there that's being done on trying to address the problem. So we have some evidence-based solutions that we want to share with you today, because you guys are trying to transform your practices, and it's really hard to transform if you feel burnt out, or if your staff is burnt out. Anyone, the concept of change fatigue, does that resonate with anyone here in the room? Please don't ask me to do one more thing. I mean, this happens in my practice on a daily basis. So we're hoping that that we can get you all to a place where you feel like there are some practical take-home strategies that you can start working on tomorrow in your practices.
Okay, so we led with the positives for a reason, because we wanted to really kind of set the stage to talk about challenges. So what that's why this slide just says challenges. So what I'm interested to hear from the group, and you can just call some things out to us about what you consider to be some of the challenges in your work day, workplace, everything from timing to not enough hours to staffing, whatever that might be. So could we hear from people in the room? Can you just call out a few things? And we're going to write them down on the board here. Interruption. Right. I read something recently that a nurse is interrupted 24 times in 30 minutes. So doesn't give you much time to think, right? Okay. Someone else here had something? Interruption. Yeah, that's a big one. What else? Okay. Competing priorities. So can you say a little bit more about that, like what that means in your particular? Okay. Personally. So personally, trying to figure out competing and prioritizing personally. How about anybody else? Okay. Is a challenge? Okay. 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 So we increase patient expectations, would you say? Okay. Okay. Right. So maybe internet health. Yes, I can't tell you how many times I've had somebody come in and be like, I just take a minute. You just have to write the script. This is what I have. I know what I have. I need to get back to work. I'm like, oh, it doesn't work that way. So, yeah. Yeah. Uh-huh. Data. Okay. 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 So it's quantity of data, but it's also understanding the data. To take a moment before that new report hits that gives you some quality metric you didn't know you were measuring, and now you have a number and you don't know what that means. Okay. Okay. Knowledge, yeah, that's true. Because it is so true. I mean, we're all going a million miles an hour, so the QA folks are working feverishly on things, and then, like I said, the report comes out and you don't know, you have no context. Yes. Call outs. Mm-hmm. Right. Right. Yeah. Call outs, and I would take it maybe one step further, staff attrition or turnover. Is that something you guys, because you know, who's ever left standing, you're the ones that get to do all the work that they just walked away from. So that doesn't feel good. So we have staff. What about from a systems perspective? I mean, even in terms of like different departments communicating with one another, was something I was thinking about, but you guys both had your hands up. Yes, right. Sicker patients. Yes, absolutely. And more of them. Yeah. And did you have something? Okay. So maybe internal, but also external community resources? Maybe not even knowing they're there, or they may be an option, but you don't know that they exist. Yeah, because you're too busy doing everything else day to day. Anything else? Do we have anything from the
Cheryl?
remote sites? Yes, Cindy.
Yeah, this is Cindy from Peninsula.
Hi.
The EHR, just in general, electronic health records.
Yes. Uh-huh. It's got us with our backs to the patients, which I don't like. I've actually started leaving my computer outside the room, and I go in, I do what I need to do, and I come back and try to remember everything I just did. So, anyone else? Anyone from Milford? Putting you guys on the spot? What's that? Okay, go ahead. Mm. Mm-hmm. Mm-hmm. Right. So communication overall, but then maybe deficits in communication or hindrances to communication, particularly around patient care. You're spending time waiting for a call back or a permission or a form to be signed. Yeah, all that can hold things up. I had a list here, which I did not want to put up because I didn't want people to feel like they were overwhelmed. But I think it's the one thing that I had put down here was an absence of shared values. So I'm working really hard doing something because I think that it's part of what the mission is for the organization, but it may not be what I'm feeling or hearing either from the top down or bottom up. So kind of that disconnect. That was one that was important to me because I've worked in places where when you have that disconnect, it can create really poor morale. And low morale is also a problem.
I think we're seeing with all the things that you came up with that the clinical care environment has become really chaotic. You know, information overload, mismatch, lots of team members, insufficient communication. So if there are steps that you can take to try to make it less chaotic, everybody's going to be feeling better, including the patients.
One other thing that I had noted down here was uncertainty. So uncertainty about the future of what's going on with value-based care, the future of the organization. I mean, just kind of uncertainty in general, I think, makes people feel unsure in their place of work. And then if you have attrition on top of it, particularly in leadership, then it's really confusing. So, okay. Well, now you know why we didn't put all this up there, because we wanted you to start out happy, not depressed. So I just wanted to kind of take all of this and put this into context for everybody and thinking about some of the major things, some of the major themes that we have here. So one of them is around time. So obviously, and we've heard that a couple of times from people, just not enough time, more work, less resources. Lack of control over your environment or the conditions within which you work, and not necessarily having a say in that or talking about that enough. This can also affect your work, but not only work, but also home. So if home is chaotic, it's going to be really hard to come into work and be feeling as if you are effective. And then chaotic or hectic workplaces, we talked about that, which is kind of the synthesis of all of this. And then being in a workplace where you perceive that your values are in conflict, either with your coworkers or with the leadership of the organization. So there have been a number of studies that have been done through the Annals of Internal Medicine and also Lancet that specifically talk about these issues and identify these challenges. So these are real. What we want to do today is spend some time thinking about this, and we're going to erase this when we're done so we can get rid of all of this bad stuff, and start thinking about solutions. So that's why we didn't start here, and we had you start with, and this was Daisy's idea to do it this way, to really start kind of on a positive note and to bring that through. And that's really the mindset we want you to keep in mind as we begin working through some of this and talking about positive solutions. Because it's really easy to talk about what's not right, much harder to come up with strategies to change it. So one of the things we wanted to lead with here was to really just have everybody, take a moment and remember that you don't worry by yourself. As much as you may feel isolated in your worry and what you do on a day-to-day basis, that if you're worried about something, your team's probably worried about it too, either because they can feel what's going on for you or because there really is a real issue that's going on. There's a great article that comes out of the perception of, what team feels like through social psychology. There's actually an article that Daisy shared with us in 2008 about just this topic. So what they did was they interviewed people to ask them to stand, and I don't know if they did this, actually took them outside and had them stand at the base of the hill, but asked just, how steep do you think this hill might be? And for those that were accompanied by a friend or a loved one, the hill seemed less steep and more surmountable. And the better the relationship between the person with you at the bottom of the hill, the less you perceived that hill was going to be an impediment. So this is true. This is true and real, that the people we have around us have an effect on our day-to-day and our perception of how we see the challenges in front of us. So in thinking about that, and this is something that I spend a lot of time in the work that I do with the National Nurse-Led Care Consortium, we talk about high-performing teams. So we've kind of laid the groundwork for you to think about your personal challenges, but I also want you to begin to think about team solutions, where you can begin to bring in team members and you can change things. And the literature, again, really backs us up on this, that when there is a higher performing team, productivity is better. When you have good and effective communication, think about in a surgical suite and the communication that's going on constantly in the suite between everyone. If that communication is not optimized, there can be errors, there can be problems, and we don't want that to happen. Everybody who's on the team needs to know and understand the scope of their role. So I do know that in the world of nursing, things often fall to us. So you need somebody to maybe follow through on a quality assurance program. There's nobody else on the unit to do that. Often nursing will be asked to take another task on. So, and it may or may not fall within your interest level or even, in the hours in the day that you have to do it. So being clear about roles, I guess, for yourselves and also with your team, how you perceive your role and what it is that you do. Shared goals are also important. We talk about people that are working together need to have a shared mental model. What that means is we came into this together. This is the end goal, and this is how we get there. So that's very important as well. And then trust. So, and this is something I think we don't talk about enough in healthcare, I mean, obviously there's got to be trust with patients and yourselves, but there needs to be trust amongst one another. So we're going to talk about that and how, and this is all borne up by the National Academy of Medicine that actually looked at this in terms of clinician well-being and resilience, and it has a lot to do with trust and your team. So again, I talked about this in with communication. So obviously, the better the communication, higher satisfaction is both for staff and patients, but also quality metrics. And we often don't think about communication necessarily in terms of being a metric or something you can look at and use to help you in quality, but actually it's something that's extremely important. When there is poor communication or inconsistent or breaks in communication, that's when you see gaps of care, particularly in warm handoffs. Or handoffs or transitions of care in general. That's when errors tend to occur, and they are the third leading cause of death in the United States, medical errors, and which is something none of us ever want to be part of. And we want to try to avoid those as much as possible. So some of the things I'm going to talk about is ways, very practical ways, in terms of not only team building, but also how to improve your communication with your team. So these are just some strategies, and you may or may not already be doing these, so it might be a review for some people, but just wanted to make sure that we talked about this. So when my team goes around the country and talks to practices and hospital associations about team-based care, we talk about the teams themselves and how they prepare for their day. So how do you prepare for your clinical day? It's very important to have some sort of pre-visit planning, so everybody's on the same page and everybody knows what's going on. By show of hands in the room, are people doing pre-visit planning as part of their day-to-day? Okay. All right. So somewhat of the minority. We're hoping maybe you might bring this back as a strategy. It can be very, very helpful. Huddles is another one, and I think maybe this one's a little bit more well-known and used. Anybody doing huddles either regularly or on a regular basis? Okay, great. I'm glad to see that. Care protocols. So those help people be clear about their role and are also very directive in that this is what happens at what point for this person, and this person can do it. Extremely important. It cuts down on the many interruptions you have in the course of a day. Anybody using care protocols on a regular basis? Okay, some? Okay, we'll talk about that more. And then standing orders, which is very old. I think most places have standing orders. And we know, but I'm not always sure we maximize the use of our standing orders or review them. That's the other thing, is healthcare is changing so quickly. We really need to look and see if what we have and the protocols we have in place still make sense. So the pre-visit planning. So these are, again, just some nuts and bolts of how this can be done, some recommendations. So it's looking at, future appointments. I know some practices will do it the day before, some will do it the day of. It usually takes some time to get the pre-visit planning done because you have to have a list, you have to have a system, a way to be able to walk through it. A big time saver, I know for myself personally, clinically, is if my diabetic patient is coming in, I want the, A1C done before they get there. I want other labs, their glucose. I want that ready for me when I walk in the room, so I don't have to then send them to the lab, bring them back, and then review it. So as much as you can do pre-lab testing ahead of time and have maybe some standing orders for that, that would be very helpful. Looking at the schedules in advance and then deciding, kind of what your game plan is for the day. And this is something that can be combined with huddles. So I guess before I talk more about huddles, I'm curious because a lot of people raise their hand. I'd be interested to hear from someone willing to share about your huddle, how you do it, when you do it. There are a lot of hands that went up before. Yeah, so tell us about your huddle. And how great is it?
We have great huddles. We have a couple of levels of huddles. We have a hospital huddle that occurs every morning at 7:30, which is multidisciplinary, all the different departments. So we go through
everybody.
Mm-hmm. Wow. And then heads representatives from all those different departments. Great. And then each of the units and departments have their own individual huddle, usually sometime in the morning or after that too.
Okay. How long does it last?
The morning one probably lasts 15 to 20 minutes. The ones on the floor, at least on our floor, last about 5 or 10.
Okay, perfect. Somebody told me once the key thing about a huddle is don't let anybody sit down. Because as soon as they sit down, it's a meeting. So that's the key. Anybody else with huddles that they do regularly?
We do a daily huddle in our family medicine clinic. We combine it with pre-visit planning. We last anywhere between 8 and 10 minutes at max. We usually run through the patients by name just quickly, make sure they're in the right type of appointment slot, make sure there's no labs that need to be gotten ahead of time. That takes about 3 to 5 minutes really to run through, and then we'll spend the next 3 to 5 minutes. We have a huddle board that's in a patient-facing area that we review. We'll just quickly look at things like quality metrics. We'll look at care gaps. We'll look at, we have posted graphs on kind of how we're doing with certain metrics. We go over who's in the clinic that day, who's not in the clinic, how many appointment slots we have available for sick visits, those kind of things. And so we involve the entire team, actually. We have 3 physicians and a nurse practitioner, MAs, front desk staff, and an office supervisor. So we all stand in the huddle at the front desk, and we go through that. And it's been a super efficient way to get through the day, to recognize who's around and what the roles are going to be for everybody in the clinic that day.
So what made you decide to institute huddle?
Interesting, when I came to the practice about 4 years ago, they were already doing it in just basically a pre-visit kind of summary where they would just run through the names. And then about 9 months ago, we upgraded it when we added the board, really, and we took our huddles to a next level. And it was partly to help close our care gaps because we had some deficiencies that we had. We wanted to make them visible to the whole team and also put them in a patient-facing area. It was also a way to, because we do have a little bit of rotating staff, so we'll sometimes have some staff come. We're short-staffed on a pretty regular basis, so we'll have people come up to our clinic from another clinic, or on the very rare occasion when provider's not there and we have some extra staff, somebody's out, and we have to acknowledge that person's not there that day. So it was a way to kind of keep track of roles in the office too. So
Great. Thank you so much for sharing that. I mean, I couldn't have said that any better myself, but I think that gives you some insight into how huddles can actually save time for you. One of the biggest things that I hear about huddles, and the reason not to do it, is it takes too much time. But again, you know, it's ideally between 5 to 10 minutes tops, and it's not pre-planning, and it's not a meeting. So it's really just a quick review. And it's great because you can highlight quality assurance if you want to get more flu shots in, or, you know, identify more people for Prevnar. That's the time to do it. So everyone, it's that mental model I talked about before, and that's one of the ways that you can set the tone for the day. So these, I think, are pretty, you know, self-evident. People know about care protocols and standing orders. The only suggestion that I would make to you about both of these is to revisit them. So it's great to have protocols, but you have to be reviewing them on a regular basis to make sure they still make sense. So your team may have changed, your resources may have changed, you know, medical care has changed, so they're going to look different. It's kind of like a job description. You got to pull it out and dust it off every so often and make sure if it still makes sense for your staff. In terms of a protocol that you may be using right now today in your practice, would someone like to share a protocol that you have now that you use regularly, whether in surgical suite or outpatient or inpatient? I know some of you said you had them, right? Yeah? Do you have them? Yes. Please share.
I can't remember everything, but
Just
pretty
one.
much our staff with the flu, let's say it's flu season, we already have our VIS forms outside. We already asked them if they have they're willing to get the flu shot. And my staff, before we come see them, they know who to give it to as a standard protocol. Things like, for example, the yearly mammograms and stuff like that they don't have to ask us, but inform us after the fact.
Right.
So things like that. That's good.
Good. Anything else for protocols to help streamline the work?
We have very similar flow in our office. The MAs review the charts before the patients come in and identify any gaps in care. And then when the patients come in when they're being roomed, any preventative maintenance is not only ordered, but it's done. So the MA will order the mammogram, print out the order, give the Prevnar, the Pneumovax, or the flu shot, and also make sure that they're getting the appropriate labs and they're up to date, especially, for instance, diabetes. We do make sure that they have the microalbumin done first quarter, the foot exam the second quarter, et cetera. And as long as you have a system approach to that, you're going to pick up 90-95%. And it really does improve the level of care. The other thing, interestingly, we were really worried years ago when we first instituted it. There were two problems. Doctors are control freaks, and they don't want to let go. And all of us had trouble. But one of my partners, I mean, we really had to put him on medicine for it when we were, let other people who, with just a high school degree, decide what medical care they're going to get, which is really what it came down to. And it was a real culture change. It's a lot more accepted now. But the second thing was the patients really appreciated it, and they noticed the change, and they came up to us and said, "This is great." So it's another aspect. We don't think the patients notice this, but they really do.
Oh, yeah. Patients definitely notice. When they don't say anything, that's when they really notice. So thank you. And I think that flows right into the standing orders then, because they really go hand in hand. So you do have to be very clear about what your protocol, and if you are delegating that authority, to be sure that whoever it's delegated to is, one, comfortable with it, knows and understands what it is you're asking them to do, and is willing to follow through on it. So that's another important piece, and that has to do about role clarification. So that's kind of an expanded role for an MA, or an optimized role, which is some of the work that we do in talking about how to take the team you already have and optimize them. Great, thank you. Thanks for sharing.
Okay, so that's a nice segue into one of our other key features of high-performing teams, which are clear roles. And we've talked already about this quite a bit, but the idea is that everybody knows what their role is on the team, and there's mutual respect. The scope and responsibilities are really explicit, and this is something that's also really important and sometimes forgotten about, is that you don't just want people to know their roles and responsibilities in their silo, but how it fits into the bigger picture of what you want to accomplish. So I told you there'd be hockey in here later on, so I'm glad to see that there's some fans in here. So it took me a while on my hockey team to realize that I was probably a better defensive player than I was an offensive player. So my role shifted to when our team had a penalty. And I was the forward on the right-hand side there. My job was to block the slap shot from the point that would set up their penalty strategy. And so the idea is that roles evolve, and having a clear game plan and being really explicit about what's expected of you, whether it be on the ice or in the office, is really important. And I think this is one of those things that we can always definitely do better, particularly in a time we heard in terms of the challenges. There's so much changing and shifting in healthcare, and we need to be somewhat flexible. So we need to be descriptive and explicit, but we also have to be flexible in what roles we play. And so this is not an exhaustive list, but these are just some practical strategies to help you achieve this. Mutual introductions, which is something that we role modeled for you at the start of this session, where you introduce each other, or when, for instance, when I have, it's that time of year again, I'll have a whole new set of residents coming into the clinic, and we have to orient them to the clinic. Being very clear about who does what, because we have, it's a pretty big setting, and there are a lot of folks who are providing care to our patients. So me being able to describe exactly who does what, and they're being able to describe what my role in the clinic is super important. So mutual introductions is one of those ways to take it from just a piece of paper. Though materials about the practice are also, how many of you guys have sort of a welcome to the practice brochure with pictures? Anyone have that? No? So that works well both for orientation of patients and new staff to the practice. I know we have Facebook, but it doesn't really, so it can say, everybody what they look like and what their name is, but it doesn't explicitly say what they do, who's doing the prior auths, who do you talk to when you need durable medical equipment, that kind of stuff. But that is something that I think would be really helpful. And then as Cheryl mentioned before, this idea that they can't be fixed and that you have to be willing to revisit roles, because I know when I go around and talk to clinicians about change and doing quality improvement work and transforming their practices, they keep saying, I feel like someone just keeps putting another thing on my back, and it's going to be the straw that breaks the camel's back. So you have to be really creative in how you reassign the roles in your clinical setting. So one of the other key features that we found when we did our literature review was that this concept of shared values and shared goals is really essential for teams to work optimally. And that means that you have to have access to the information, and everybody needs to be clear about what they're driving towards together. And we have a worksheet that you have in front of you, and at the end of the session today, we're going to go through setting some SMART goals for you to bring back to your practice. Raise your hand if you use SMART goals already in your work. Okay, so good. So we're bringing you something, because you guys seem like a bunch of pros here. We're bringing you something that maybe you didn't have already, a tool to look at goals that are really specific, measurable, actionable, realistic, and time-bound. So this is not supposed to be rocket science. The idea is that you base your goals on your shared vision, and then you can use the worksheet, you can copy it and use it in your team meetings. One of the things that we heard about was that your patient populations are evolving. So this is a really good thing. When you have an evolving patient population, you want to make sure that the goals that you choose to drill down on, whether it's a specific set of quality measures, whether it's some patient experience stuff, that it really matches the population in your clinical setting. And then this is something that I probably learned the hard way, is you have to think broadly about the stakeholders. And I love the comment that you made earlier today about how much the patients loved the standing orders and having the MAs do the healthcare maintenance piece, because our patients are one of our biggest stakeholders, and a lot of times we don't involve them in this. And what I've been amazed is we started to involve our patients in deciding, because you have to prioritize what project are you going to take on. The patients often will drive you to something that you hadn't thought about before that may actually be a least expensive option. We have a tendency to overthink things. At least, I mean, I'm an internist, so I'm always like, caught in my head and way too analytical. But they'll come up with things that are really simple and straightforward and not, and I may not have thought of, but have a really big impact on the patient experience in the practice. So think about your stakeholders. And then the other thing is everybody, I mean, hospital systems all over are spending so much money on coming up with the data solution, right? Having the perfect dashboard and data visualization, and they're spending millions of dollars with this. I say, keep it simple. How many of you guys use run charts in your practices? Yeah, okay, good. So we have a couple. This is just a really simple thing. So the idea is if you set your goals, make sure the goals, that's the realistic part. Make it a data piece that you are already capturing in some way, and then you can see what your baseline is. And then when you implement the change, and the x-axis is time and the y-axis is % compliance. So a run chart is another very simple tool that you can do to track and see whether or not you're meeting your goals. All right, so another key feature that we wanted to talk about was mutual trust and psychological safety. Sounds very buzzwordy. It also sounds like it's something hard to have practical strategies around. But a lot of, particularly in the tech industry, but also in the healthcare industry, Google's done a ton of work trying to optimize their teams. And what they found was psychological safety was the #1 most important thing. So what do we mean by that? How do we define it? It's that everybody who is on the team feels comfortable. They're not afraid to speak up, to ask a question, this concept that there's no question that's too stupid. They don't feel like they're going to be embarrassed or punished if they admit that they made a mistake. And then there's a lot of leadership role modeling that has to take place, because the leaders really sort of set the stage and the culture for this, so they need to role model. And some things about role modeling, it's not just soliciting input and asking people what they think, but then it's also demonstrating how you're following through and following up on what they shared with you and showing them how what they shared actually changed what you did. So leadership role modeling we already talked about. I was recently listened to our former Surgeon General, Vivek Murthy, talk, and he's doing a whole lot of work on loneliness. He mentioned when he was working leading the Surgeon General's office that he started this thing called the Inside Scoop. So I thought this was like a really practical take-home thing, because one of the things none of us have is very much time. And so same with the Surgeon General, he has big things to tackle. So his weekly team meeting, they added something called the Inside Scoop, where one of the team members would show a picture of something outside work. It could be a picture of a cover of a book that they read, or a place they went on vacation, or a favorite pet, and would talk about the picture for 5 minutes before they started the meeting. And he said it was amazing how such little time really helped connect them. Then they asked, oh, how was your nephew's wedding? I mean, just like we learned this morning, earlier at the beginning, how little we talk about positive things. We also don't really talk that much about personal things or things outside work that are important. But the more we know about each other, I mean, I'm not talking about oversharing, but the more we know about each other, we can help support one another and just get to know each other on a different level. So that really helped his team. And I think I covered the other things there. So the last thing that I wanted to touch on, and this is really purposefully last, because we heard loud and clear from our members that they didn't want to hear that burnout was the problem was them. And they said, don't tell me to yoga my way out of this, because I'm not the problem, the system is the problem. But what we found in our research about optimal teams is that it was only optimal teams that helped combat burnout, and it's very hard to be a good team member if you're feeling burnt out. You know, like on the airplane, you have to put the oxygen mask on yourself before you can help other people. So taking care of yourself is not selfish. Which I think many of us think, oh, we just got to suck it up. You know, this whole concept in medicine about being strong, you know, there's strong clinicians and weak clinicians, and you got to be strong and you got to be tough and just take it, is really a cultural shift that we have to change. So I'm here to give you permission to take care of yourselves. We're here together telling you this is really important stuff. And that small changes can have like a really big impact. So I'm interested in hearing from the group, what things have you done that are very time consuming, but like have made a difference to you in your day-to-day work or in your life or in your work-life balance. So I'll start by sharing gratitude is something, and it's a simple thing. Just right before you go to bed, think of 1 or 2 things that you feel grateful for. And then if you get in the habit of that, you'll realize that it ends your day feeling really good. But the other thing is make sure, I think it took me a long time. I was a program director for 10 years. It wasn't exactly 10 years. It was a couple years in before I realized how important it is, the value of catching other people doing things right. So this is another powerful tool you can use to build your teams, and your gratitude for what they did or your acknowledgement of what they did well needs to be super specific. I really appreciate the way that you went the extra, mile with this patient, or did you see how happy she was when she left the room after you congratulated her for quitting smoking? Whatever it is, but just make it be specific. And those things can help. So what other strategies do you guys use to help with your personal self-care and your personal well-being? Anyone want to share?
Well, I was going to share mine. One thing that I've done recently, which seems to have just helped me tremendously, is just mindful breathing. It sounds silly. There's this whole mindful meditation thing, which takes a really long time. And I've done that too, and it's great, but I don't often have enough time. But mindful breathing is actually just stopping and just focusing on your breath for a minute. So like sitting in the room right now, just like, so there's times when I'm starting to feel a little overwhelmed, a little anxious. And if I can just stop, even in a room where there's a lot of stuff going on, and just focus on my breathing for just like a minute or two, I notice it takes me back to a different place. So that was just one, because it's quick, easy, and I could be standing in a room right now doing it and you would never know. How about anybody else? Strategies that you might use at home? Nope. Here we go.
I use music. When I'm working on a project and I feel a little overwhelmed with it, I will put my meditation music on, and it just makes it flow easier.
Wonderful.
So sometimes I feel like an episode of Bad Moms every day, traveling to work, getting up at 5, going to work, trying to please everybody, and then coming home from work, having the dogs and taking care of my child. So my little girl falls asleep when I pick her up from daycare going into my house, and I realize that instead of going right into the house, trying to make dinner and figure things out, I actually take 5 minutes in the car before I go inside while she's sleeping, just for myself, just to regroup before my next job starts when I get home. And I just found that 5 minutes has been really helpful for me. Might be 5 minutes, but it's a really good 5 minutes.
That's a great tip. What about from the folks who are joining us remotely? Anyone want to share?
So how about our
strategy?
Cindy in your group? Any strategies you can share?
Looking.
You're looking around?
Anyone have anything that they do? Mine was music too. Music, yeah.
Music? Okay.
So just while we're waiting, we don't want to belabor this point, but one of the things, how many of you guys have had an ergonomics evaluation at work? Okay, so we got a couple. So someone was telling me, we spend a tremendous amount of time on the computer, at least I know I do, and I had an ergonomics evaluation. I have a standing desk now, which has been great. I know it's expensive, but someone was telling me like the amount of force, a week in the hospital, the amount of force that you put on your thumb could like push a tractor trailer around a city block by the end of the day. It's just incredible the amount of time that we spend on the computer, and it's not in a mindful way. So an ergonomics evaluation could be like a really simple, practical thing that may have a really big impact. Anyone else want to share something? Yeah.
Talking about your ergonomics, I have the stand-up desk. I also have a rollerball for my computer, so I don't have the tunnel problem. And I also have a exercise ball that I sit on when I'm not standing. So it kind of helps my back and helps me do things along with my music.
Yeah, and with the ergonomics, check with your HR department. Many of them have the ability to do that for you. You just don't know to ask. So I would definitely go back and ask and see if that's an option and what the options might be. But again, reworking even your workflow and your workspace may not be optimal. It might be setting people up or yourselves up for accidents, or if you've noticed there's been a particular issue, it's a good time to kind of relook at your workflow as well.
Great. All right. Well, hopefully you've got some practical strategies there. So I'll turn it over to Cheryl to run the final part of this program today, where you guys are going to go through all the practical strategies that we offered you and pick out some that you're going to take back to your teams.
So first of all, does everybody have a smart sheet? So what we wanted this to be was something you could actually walk away with as sort of a promise to yourself that you're actually going to follow up. I know that I attend countless conferences and walk away and say, oh, that was a great idea, but now I got to get back to work. So what we wanted you to do was does everybody have one? Does anybody need one? Okay. So what we wanted to do was in the top part of this, you're going to be looking at what the goal is. So I know we have our long list here of all of the challenges that you have. So maybe think about that, or the ones you might have offered up. And what would be one, I guess I would ask you to pick something that would probably be low-hanging fruit, so something you could probably implement relatively easily, either as self-care or you know, something within your organization. So we're going to go, just going to do a list here. Sorry, here we are. So this is a review, and this is actually some really important slides. So we've done it in categories here of looking at ways to start to make some changes in your workplace, and maybe even some of this that you can bring back to home. So in looking at communication, some very straightforward things, you know, the pre-visit planning, understanding the difference between that and a huddle, which I'm glad you pointed out, because I do think people think they're one and the same, and they're not. The care protocols, standing orders, that's something very concrete, that if you're not doing them, or maybe you want to revisit them, we have some resources. And there's actually a lot of good stuff on YouTube as well to look at both good and bad huddles. If you want to get a sense of what, or you already may know what the bad ones look like. Role clarity. Again, one of the things that I ask staff to do, particularly nurses, to ask for a copy of their job description. So it seems like a loaded question, right? But I think it's important, if you're going to be asked to perform in a particular way in whatever your job is, you should know what the job description looks like. You probably saw it when you were hired. It's probably signed and filed. So it's worth asking, and to ask for your job description. So what I have done in a couple of organizations I've worked in is I did exactly that, and there wasn't anything in there that I related to in terms of my actual job. So actually, I offered to rewrite it, and they were very happy to have me rewrite it. So, and I did that in conjunction with the supervisor, and we, you know, filed it again. But again, so job descriptions, the mutual introduction. So anytime you have a staff meeting, would encourage you to do that. That's, you know, simple and easy to do. But also, I would say that that's extremely important to do in front of your patients. So I know oftentimes we have people trailing behind us. It's either a student, a resident, somebody from somewhere, and we tend not to introduce them. But you know, we really need to say, you know, my name is this, you know, this person is working with me today. They're a medical student or they're a nursing student. So making sure that people know who's in the room. Because I can't tell you how many times I go in to see a patient and they'll be like, oh, you know, the nice lady with the dark hair was going to come back and give me paper. And I'm like, oh my God, I don't know who you're talking about. So, and that's when those bio cards that Daisy was talking about, if you have something in the office that actually has your pictures and your role, the dietitian, you know, and there's a picture. So that's also something to think about. Building trust. So the listen more, talk less. I try to do that. I have a tendency to talk a lot. I'm trying to listen more to what people are saying, but ask for help when you need it, but then follow through. So follow through is not always my strong suit, but I'm trying to get better about that, and that's something that I think that would be helpful. Mutual feedback. So when you're having a conversation, say back what you hear. So what I hear you say is, but what I think you mean is this. That's particularly well in a situation that might be escalating. So that might be something that you can use. And then the inside scoop, which I loved. I thought that was a great idea, just to have somebody bring it up, obviously discretion, a picture, and then share that at a team meeting. And then some ideas there for personal well-being. Is there anything that's like glaringly obvious on all this list of things for you to consider that we have not addressed, or things that you're using that you think should be on this list in terms of self-care, or things that you would want to take back? I think I hit on everything, but I just want to make sure. Okay, so we are going to take a couple minutes right now. So if people can, so put down what your goal is at the top, and then we want you to take you through the exercise of how do you make it SMART. So how do you make it, it's got to be something specific, that's measurable, attainable, relevant, and then time sensitive. So if we can take a couple minutes and do that individually, and then we're going to ask some people to share what goals they're taking back. So for the off. Hello. So for the off-site groups as well, we hope to hear from somebody in each of the remote locations. So think about that. And we'll be sharing in about 5 minutes. I'll put you in charge of that in your spot, Cindy.
It makes it sound so high stakes.
I had to, sorry. Yeah. We could listen to something else. I have no idea what that is. So we're going to give you guys another minute or two. I see some people furiously writing here, so that's great. Yep. So why don't we take a couple people that are willing to share? And just as a reminder too, I believe that the PDF file for this will be available to those participating. So the last couple slides are many of the resources that we've been referencing throughout today. So just so you know, there's some places that you can go. Would anybody like to lead us off with their SMART goal?
We have somebody out here at CRNP.
Oh, good. Tell us your name.
Go ahead, Diane.
Hi, I'm Diane Hyde.
Hi, Diane.
I'm with the I'm with the behavioral health. Hi.
Are you really big now? Yeah. Hi, Diane.
I I promote the behavioral health services at PRMC, and I think the inside scoop for under building trust, the inside scoop is awesome, and that's something that I will definitely take back to my team. I think just sharing that personal, little bit of personal experience about yourself really helps connect, and just you really have that comfortable feeling with each other, and just it really helps us as a good basis for building the trust.
Great. So when are you going to do that? So we're going to tie this back to our SMART goals. So you're very specific and, you know, measurable. I mean, that may be a tough one, but what's your time frame to bring it back to your team?
Well, we have weekly leadership meetings on Tuesdays.
Okay.
So during the leadership meeting next Tuesday, I will definitely share with the team, as the leaders of each behavioral health unit, and the director is also in that meeting. So I will definitely share that with them when I go to that meeting.
Great. Good. Thank you for being the first. Appreciate that.
Thank you.
All right. Who else in the room would like to share? I saw a hand go up. Yes. And just, and then you take the mic after. Tell us your name and where you work.
Hello.
There we go.
So my name's Jennifer Joy, and I work in vascular access. Our big picture goal was to be fully staffed.
Fully staffed.
Yeah, we have a small group, and you know, we've had a few turnovers recently, and just a few team members being out really puts a big impact on the department.
Yep.
So that's our goal.
Okay. So what strategy will you take back to help, I guess it sounds like, retain the staff that you currently have, to help them feel connected?
We're going to build trust.
Okay.
Talk more or talk less and listen more to the needs of the department, and we're going to follow up with the feedback that we get.
Right. One of the things that I wanted to bring up, because it's something that I often use with staff, is I do something called a stay interview. So everybody's heard of the exit interview, right? And then it's too late. They're out the door. The stay interview, for me, I've distilled it down into just a couple of elements, and maybe you want to think about this. So why do you stay? Why are you here? What do you love about what you do here? And what could I do to make it better for you? So those are my 3 questions. I mean, the stay interview is very, very long, but I think if you're looking at your team and maybe asking that of one another, that might be a good way to bring things out, because I can't tell you how it's the little things that make us stay and the little things that make us leave. So, and you often don't have an opportunity to talk about that. Sure. I know they wanted to hear from you.
Oh,
okay. Your name tag.
Oh, okay.
Tell us who you are.
Okay, I'm Tosh Heiliger, and I'm with Bayhealth Physician Alliance Clinical Integration. And one of the things that I want to take back to the team, we have daily huddles in our department, so it could be our team and we're in the building with others, is the personal well-being. And I was sharing with Ebony that there was something that I was doing on a daily basis. I started a couple weeks ago, and it kind of helped to refresh. And I would go out to the car and read over my Bible study notes from the week, because I found it hard to do it once I got home. And there's someone talked about their second job starting when you walk through the door at home with husband, kids. And it kind of was just encouraging in the middle of the day, and helped me go over my notes. And I kind of got back out of the habit. So it doesn't have to be that, but that one thing, whether it's the breathing exercise or something that takes a few minutes to kind of reflect back and do something for yourself.
So when are you going to start?
I can share it tomorrow at Huddles.
Tomorrow?
This week or tomorrow, depending on, sometimes our participation might not be.
And then do you want to set a goal for yourself that you'll do it every day for a certain period of time and then see how it goes?
Yes, I am going to set a goal. Yep,
so
every day.
Again, that's the follow through that's tough. So when especially when we're making goals for ourselves, make sure you approach it in the same way you would do if I said to you, listen, I need you to do something for me. I need you to cover shift for me for tomorrow. You would take that very seriously. So take it just as seriously. I hear some talk over here in our folks. I'd love to hear from you guys. Well, whoever would like to share, tell us your name and what you do.
My name is Terry. I work in the operating room, and I was just connecting on hers, and that I would, sounds like a good idea. I think I need to take some time during the day to just kind of regroup, even if I take it out of my lunchtime or whatever, because I am feeling rather stressed.
Right. Like get out of the building?
We can't.
Oh, you can't get out of the building even for lunch?
I can't find the door. No.
They lock all the doors. They won't let you out. Okay. How about anyone else on your team? Because I would imagine surgery, surgical suite, high stress. So not necessarily disproportionate to everybody else, but it's a different kind of stress. So any other thoughts from your team here? Give her the mic.
Any time away
right.
to yourself. And sometimes the day's over by the time you think, hey, I didn't even take 5 minutes for me, and your brain's on 1,000 miles an hour, and you just can't regroup, and you feel like you've accomplished nothing.
Right.
So some days, I mean, it's great hearing all this, but some days it's like, how am I even going to do it?
Right.
So the struggle would be to even initiate doing something because the day is so fast and busy all the time.
Right. Is there a time for you guys, say at the beginning, because you probably go through the roster of who's on the surgical list for the day, right? Is there time maybe at that time or just before then that you might be able to bring this to your team to talk about it, about the, either less than 5 minutes? Okay. Okay. Okay.
On that, just because I can totally relate to how you guys feel. I feel like that a lot of times. And even when you feel like those are the times that you actually need to take it the most, is when you feel like you absolutely no way can you do it. So that's why I like the oxygen mask on yourself before you put it on the patient or on whoever else, or the child, because you really do. And the thing is, once you start doing this, it's very empowering, because part of the thing that was borne out in the literature is that people feel like there's a lack of control, that you're completely lost yourself in the chasm of work, and there's always going to be more work. But the idea is it doesn't have to take a long time. I know just the other day I was rushing between my 2 offices, and I was getting ready, and I felt completely depleted, and I sat in my car. It just took a minute, but did like breathing exercises for a minute, and even just a minute, and everybody has a minute, is just take that time, and you'll feel so much better. So maybe just committing to, when you're feeling like things are out of control, taking a minute, doing a breathing exercise, listening to your favorite song. Maybe you can't hear maybe you don't have time to hear the whole song, but you can hear the couple of bars that really make you feel good and energized. But this concept of having some semblance, taking back some semblance of control is really important. The other thing was just the bookends of the day are really stressful. We heard someone here already left, but she talked about coming home at the end of the day and transitioning to be a mom, and just taking that moment during the transition to just sort of get her act together before she walked in the door. So I think I just think it's really important to try, if you can, also with your staffing, and this is something you could do with your huddles or however you organize the day, giving people more flexibility, either the beginning of the day or the end of the day, if that's possible, will also help you keep people around and stay. Even if they have a little bit of flexibility there, figuring out what's important to them and giving them some control over their schedule can really help.
Great. Anybody else? Yes. Come on, we're hearing from the surgical suite here. I love it.
I actually wrote. My name is Daisy, and I work in the operating room. I actually wrote about our effective communication. I think too often we don't communicate well, and we always hear things around the grapevine or through the grapevine. Huddles. We don't do our huddles anymore. Taboo to us. I mean, we used to do it, and then we got away from it only because we're so rush to 7:15 first case start. You have to get in your room. You have to do this.
Right.
So we don't even dedicate that time anymore to communicate with the team what might be happening in the organization,
Right,
or whatever the
right.
case may be.
We're in
So
our
we're like in our
silos.
own little bubble. So if we could get back to that, just to take time so team knows that they're valued, team members that they're at least valued, and just get that extra 2 minutes or whatever it is, just to keep us informed. So we
Right.
don't feel like we're here, get your patient in, rush throughout the day, and then you're out the door.
Right.
And you're not connected in any other way.
Mhm.
So
So do you have the ability to take that back to your group and say, hey, I'd like to reinstitute huddles? Can we talk about how to make that happen?
I certainly can take it back to
Okay.
our manager. If it will happen is another
Right.
question. I wish, we come to these conferences, and it's sad that the people that probably need to hear this as well is not here, and we're left to take it back and then to struggle sometimes hearing it.
Right.
It's not like we don't know this. We do know what the issues are. It's just having the things implemented to
Right.
change how we feel.
Right.
So
And
it's easier said than done.
yeah, and that's so true. I mean, I hear that so often. A lot of times the staff that do end up coming to our trainings are not the ones that necessarily can make the decisions. But what this does is it gives you something to bring back, because the other thing is you might want to run, we call it Plan, Do, Study, Act, a little PDSA cycle on it with Huddle Without, and then maybe look at something like either patient satisfaction, staff satisfaction, or error rate. If you can tie it back somehow to a metric, you will have all your supervisors listening to you. So think about that. And when you bring something like this back in terms of a huddle, this is not feel good. This is not just because, we want you to just, we do want it to be a feel good, but it's not just that. It decreases errors, it increases retention of staff, and it increases your teamness, feeling a part of the greater whole, which it's going to cost them money to replace you. So every time somebody walks out the door, it's a lot of money walking out that door. So just in summary, so we talked about all of this today, and we certainly appreciate you hanging in there and your patience. That, staff burnout, and it's pervasive, it's there, it's gotten worse. There are evidence-based solutions. Again, don't address a problem with a problem, address a problem with a solution and an evidence-based solution. It really has been proven to help not only keep your teams together, but also keep people in healthcare. I mean, I'm hearing nurses are leaving healthcare because they're up to here. Like, I can't do one more thing. And that's not what we want. We want people to stay. And then also, remembering too that it's your personal strategy as well as, leadership strategy to try to get this, to get this done. These are some resources that we have, I just wanted to share with everybody that you have, that's all evidence-based. These are some provided by the ACP. This is very well documented. Please go, you can look at team steps. Lean is another one. And again, it's both with medicine and with nursing. And I just an acknowledgement slide. Some of what you saw today is a collaboration for us between ASU and their Interprofessional Practice in Education and Research. So they devote an entire learning center to interprofessional education, where they train different disciplines together, which we also think is part of what will help to heal healthcare, is bringing us all together. And then for ACP, I don't know if you wanted to, okay. So these are just, again, acknowledgements on the part of ACP, Mark Linzer, we have Sarah Poplow, Carrie Palmera for this partnership and bringing this work together. Obviously, there's a lot of people that support the work, and again, it's been very well documented. So again, we just wanted to, thank you for your time. But before you leave, any last comments or questions from the group? I know we've heard about the challenges of bringing it back to the C-suite for people to actually help this happen. Anybody else? Any thoughts?
So we became aware of the issue that you were saying, which is that the people who are in the room aren't necessarily always the decision makers. So on one of the resources, the ACP Practice Advisor module, it's all created around how to make the case. So you guys have free access to that module, but it's about making the case to invest, and it is an ROI. I mean, there's actually a calculator that you can do to show them that they will be saving money. Each physician that leaves costs $500,000 to replace. Nurses are very expensive to replace, even MAs, and you don't want to get into that downward spiral where you're understaffed, everyone's overworked, stressed out, and then you lose more and you can't recruit to a burnt out practice. So there's a real ROI to be made. One of the AMA Steps Forward module actually has a calculator. So you can go ahead and you can come to your leadership with some numbers. So I would encourage you guys to take advantage of those things.
Cheryl and Daisy, this is Cindy.
Hi, Cindy.
I just wanted to thank you both for this today. We really appreciate it. And it was a really great session. And I just wanted to let everybody know that this session was recorded and will be available, the presentation part, on YouTube, our YouTube channel, the PTN YouTube channel, and the handouts will be sent out to everyone who provided their email address, who registered. So please take, use the resources, take advantage of those. I think they'd be really helpful to a lot of people.
Right. Thank you, Cindy, for saying that, and thank you for having us today. Dr. Begley, do you want to take us out?
I just want to thank these wonderful presenters. They really have done a great job with a timely, valuable, and useful and usable message. Thank you.
Yeah.
Really appreciate it. And thank you all for coming. Next month, our conference is going to be the debate.